To health matters now, the Nigerian Association of Resident Doctors has suspended its warning strike following commitments by the federal government to address their key demands. The strike, which started on Friday morning, was called off on Saturday night, barely 2 days after the commencement, with members instructed to resume work on Sunday. President of the association, Tope Oshundara, confirmed the development in a statement after the association's extraordinary National Executive Council meeting on Saturday night to review the strike and government response. He said the suspension was to give government a 2-week window to fully implement its demands. Let's bring in the President, National Association of Resident Doctors, Dr. Tope Oshundara. Dr. Oshundara, thank you for joining us on the news tonight. You said that some demands have been met. Can you specify which demands exactly have been satisfied so far and how government has implemented those solutions?
All right. Thank you for having me. The demands that have been met so far is just the payment of the balance of the medical residency training fund. But beyond, funding for this training, there are other lists, a list of demands. In our list of demands, there are issues of remuneration, incentives still being owed. And you agree with me that a laborer deserves his wages. So a laborer should have his keep. And we are calling on government to, adhere to the memorandum of understanding that the government has signed with us. The areas that is still being owed includes the 5 months commerce salary, 35% salary areas. We still have a 7 months accoutrement allowance areas that is still being owed, and we are telling government to do the needful by paying this money. If you have worked since 2023 and you are still owing us till now, I really don't think that is good enough on the part of government.
All right.
And we've waited long enough to have this money, and we are telling them to do the needful. We also have issues of shortage of manpower. Then we also have issues with review of the salary structure. These are part of the things we are also trying to do to help the government retain medical doctors in this country.
Let us talk about the downgrade of membership certificate and corrected circular on remuneration. What concrete changes are you asking for, and how will those changes affect your salary as a doctor and also professional standing?
All right. If you have a certificate that is devalued, it does mean that professional credibility is at stake. And what we are telling government is to ensure that we are placed, on a proper, we are given a proper certificate, rather, so that we can also compete with other counterparts in other parts of the world. If you give us a certificate that does not show us worthy enough, that's not good enough for this country. It is demoralizing, and it's not going to help us. But a good certificate will ensure that we even have a better pay. And it is one of the reasons why when you go abroad, people value you, they give you better certificates, like you are coming out of Royal College of Medicine, Royal College of Physician, and you are bold, you are confident, you can present that certificate anywhere in the world. And that is what we are expecting from the National Postgraduate Medical College of Nigeria and the Medical and Dental Council of Nigeria. So, in essence, we want better professional credibility with our certificates. And as regard the circular that we are expecting from National Salaries, Incomes and Wages Commission, there was a time when they gave out an obnoxious circular which was demeaning to our profession. We told them that we are rejecting this circular, and the circular was withdrawn, lucky enough. This circular has now been corrected. We expect government to have released this circular, the corrected circular. The National Salaries, Incomes and Wages Commission has done well enough to correct, because we pointed out to them areas, the gray areas in this circular, and they agreed with us. So after agreement, what we expect from them is to release this circular. Let me have you know that the remuneration for doctors was last reviewed over a decade ago. And we've been, managing, cooperating with government since then. And now, when we are expected that the circular will be released, they are still withholding it. So my own members have, raised, frown at this, action of government, and they are saying that within the next 2 weeks, government must do the needful, release the circular, give us a better pay.
You've given government 2 weeks now to respond to your demands. If nothing changes after that deadline, what specific actions will the association take, and how will you balance that with the need to keep hospitals open for patients?
All right. The reason why we've even gone back to work is because whatsoever we are doing, we also want to give human face to it. Government entered into a negotiation with us with the agreement that they are going to expedite action on the other list of demands. And we are holding them true to their words. We don't want them to breach, the contract or the agreement they've reached with us. And that's why we're giving them these 2 weeks. After the 2 weeks, we are going to have an AGM, and that's the highest decision-making body of the association. The AGM is going to direct us accordingly. What we are going to do will be determined by the members of the Congress. And, well, after that 2 weeks, I'm not going to speak for them, but certainly the actions will be louder.
Dr. Tokwe Oshundara is President, National Association of Resident Doctors. Thank you for talking to us.
It's a pleasure.